Hello, welcome everyone to our 50th anniversary webinar series. I'm Gina Capra, Senior Vice President of Training and Technical Assistance here at NAC. We are grateful to all of you for joining us today. We are also appreciative of our nationally renowned speakers for today's fireside chat, focused on our nation's back to school efforts, COVID-19, and the importance of over 3,000 school-based health centers and school partnerships supporting students and communities. Before we get started, we'd like to acknowledge our colleagues in the West dealing with the expansive wildfires and our colleagues in the Southeast, particularly the Gulf region in the path of Hurricane Ida. You are in our thoughts as you continue to care for your communities during these trying times. To kick us off today, we will start with a NAC Spotlight featuring national policy efforts that support not only school health, but general health center operations as well. It's my pleasure to introduce Joe Dunn, Senior Vice President of Public Policy and Research here at NAC, to highlight our policy work. Joe, let me turn it over to you.
Thank you, Gina, for that introduction. And as Gina mentioned, I serve as the Senior Vice President for Public Policy and Research at NAC, and I was previously on Capitol Hill for over a decade and joined NAC in January. In this role, I have the privilege of leading this Public Policy and Research Division, which consists of 5 different departments. And these are all distinct roles, but together we work to ensure that NAC continues to be on the forefront of working with Congress and the administration and are aware of trends and the latest research to help push our case with external partners. So I wanted to take a few minutes today to describe some of the latest, the status of the latest issues that we are tracking right now. So if you can go to the next slide. So we are working on around capital funding for health centers. And I understand that some of you may be thinking this is not the time to ask for more from Congress, and we just got enough funding from the American Rescue Plan. And I understand that sentiment, and I would suggest to you that it's actually the opposite. It's precisely the time to do so. The tight margins in the House and the Senate mean that this window of opportunity may close very soon, and if one or more, both of the chambers flip, then very little gets done in Washington. That's not a partisan statement. That's just a reality that gridlock is potentially around the corner if one of these chambers switches. So as I mentioned, a major focus has been around health center capital funding. The American Rescue Plan from earlier this year included $1 billion for capital for health centers. We have heard loud and clear, though, that more is needed. That is also supported by data. You may have seen that Capital Inc. estimates that health centers will need $17.5 billion to continue to modernize and expand facilities. And so that takes us to Congress. And there are 2 tracks for infrastructure right now. There's a bipartisan package that overwhelmingly passed the Senate earlier this month. And that bill is dedicated to traditional infrastructure, bridges, roads, highways, ports, things like that. The second track is likely going to be considered as part of a strict partisan process. And the current thinking is that there could be a massive package as high as $3.5 trillion. And that would be the one where it could include a number of healthcare initiatives, expansion of Medicare to include dental, vision, hearing services, drug pricing, potentially health center capital and workforce funding. So if you could go to the next slide, NAC has been supportive of $10 billion over 5 years for capital funding. And that's the same level that key leaders like House Energy and Commerce Chair Frank Pallone is pushing. So we need you all to join the effort and express your voice to members of Congress to ensure that this happens. You go to the next slide. While making the case for capital, we must also advocate for funds to build wider pipelines for the next generation of clinicians to serve patients. There continues to be a lot of interest on Capitol Hill to extend some of the funding from the American Rescue Plan or to permanently authorize it. So as you can see there, National Service Corps funding, Teaching Health Center, Graduate Medical Education Program, other workforce programs that assist health centers and primary care settings are really important. That's one of the things that we're trying to push within this next package. If you go to the next slide, another important issue is 340B, and we've been working on on a bipartisan bill and supporting that. It's called the 340B, Protect the 340B Act, and it's similar to a lot of the state legislation that's passing right now, addressing the issue of pickpocketing, or when a PBM or insurer looks to siphon away PBM savings from health centers. There continues to be a general reluctance from many on Capitol Hill to legislate on the issue of 340B, given the competing interests from a number of different stakeholders. So the only way to push back on that perception is to demonstrate a strong show of support by getting members of Congress to sign on as co-sponsors of this bill. Right now, as you can see, there's 27 co-sponsors. We need that to grow to showcase the depth of support across the Congress to really move this forward. If you go to the next slide, we continue to push on the issue of telehealth. At its core, what we need is language that allows for many of the public health emergency flexible policies that are listed here, as you can see in the first few bullets, to continue beyond the public health emergency. So the challenge, though, is that there is skepticism about whether these changes should be made permanently. A lot of talk and attention has now been made to the need for more information and data and research. So because of that, we could likely see a short-term extension of the current policies at the end of this year while the issue is studied more before any permanent action is taken. And if you could go to the next slide, the last big issue that we are pushing is related to general health center funding. The House has taken up and passed their version of the bill, and the overall program is slated to get an increase of about $150 million with several set-asides, including funding for school-based health centers, which we're talking about today. There's also a new cancer screening program, the continuation of the ending HIV epidemic at health centers, and there's a bigger conversation that we're having with the administration and the Congress about our mandatory funding and the president's commitment to double the investment within the health center program. While the funding was not included in his first presidential budget, that pledge to work with the Congress was included, and we want to make sure that we continue to push that forward. So if we go to the last slide, I know that's a quick overview of what we're doing on the public policy research team, but you can find information about all those things and others by going to the hcadvocacy.org website or by emailing myself or others on our team to get more information. So with that, I'll hand it back over to Gina.
Thank you, Joe. You and your team are doing fantastic work. We appreciate you and all our advocates in the field. Okay, so you highlighted several areas of policy work, Joe, that have been impacted by the pandemic over the last 17 months. The pandemic has highlighted the crucial role of partnerships in service to our local communities. This has been felt acutely in caring for our school-aged population. As schools closed their doors around the country over the last year, school-based health centers pivoted to virtual care and thoughtful outreach to kids and their families. Health centers intensified their close communication and coordination with local schools, school systems, and social service organizations serving children and their families. Today's speakers will share their experiences and insights on serving the school-aged population. We are fortunate to have these inspiring faculty here today who are advancing school-based healthcare around the country. Now it's my pleasure to introduce our panelists for today's discussion. First, let me welcome our moderator, Robert Boyd, President and CEO of the School-Based Health Alliance in Washington, D.C. NAC recently partnered with the School-Based Health Alliance in authoring a short technical assistance document providing tips and approaches for health centers to consider when establishing or enhancing school partnerships specifically for adolescent COVID-19 vaccination efforts. It's a complicated and critical area, and we are so grateful for Mr. Boyd's leadership in this space. He and his team truly are kindred spirits in school health and community health endeavors. Next, we are excited to have Yvette Highsmith Francis, Regional Vice President at Community Health Center, Inc. in Connecticut, who sponsored dozens of school-based sites. And lastly, all the way from the beautiful island of Oahu, a warm aloha to Dr. Mary Okihiro, Pediatrician at Waianae Coast Comprehensive Health Center and Associate Professor of Medicine at the University of Hawaii. Thank you all for being here today. Robert, take it away.
Let's get started. May, it's back to school season with many students and staff in person for the first time in nearly 18 months. And for others who've been going in person throughout, there are elevated concerns about the Delta variant. What steps are your school-based health centers taking to support a safe return to the classroom?
So we have 3 school-based health centers, 2 at the local high schools and 1 at the middle school or intermediate school, as we call it. And we definitely had to shut down over the last year and then reopened in spring, in March. And so we've been focusing on testing students in the clinic. And so that's really taken some time because our school-based clinic, like many, I think, is very tiny. And so if we have multiple students coming in for sore throat and cough, we need to be able to separate them, to test them, to, treat them with confidentially. And so that's been a challenge, but it's definitely a need that we've focused on. And then the second thing is we've been definitely rolling out the vaccinations. And so we have them available at our clinics. We've held vaccine pods where vaccine events and invited students and staff, teachers to come and participate. And I think the third most important thing, or not most important, but essential thing, is that we have been having regular meetings with the school-based administrators, school administrators, and teachers to talk about their needs and their questions and how we can best coordinate services. And that's been really important from early on. And so I think that's, yeah.
Yvette, same question to you. What's happening in Connecticut?
So first I want to say good afternoon and thank you to NAC for hosting these fireside chats and for this really pertinent conversation today. And I'm so honored to be here with my colleagues who I have a tremendous amount of admiration and respect for. And today we in Connecticut had some of our first schools open for this session of school. And one of the first things that we did was to really ensure that our staff are vaccinated. And then we're very focused on supporting our district partners with access to the vaccine for age eligible students. And we've been doing that since the vaccine was approved for our young people who are school age, and making that vaccine available both in coordination with the schools, but also being out in neighborhoods where our students and their families live. Following through with the policies and procedures outlined by the district. And so ensuring that our school-based health center space is in alignment with that. Very similar to Dr. May, we are also a partner for testing and vaccines. We've been very fortunate that we were able to offer access to the testing to not just students who were enrolled in our school-based health center, but as a part of Connecticut's public health response. And so we really learned from what we had done as a federally qualified health center who was a first responder partner for the state of Connecticut in learning how to do some of this work outdoors. So our COVID testing in schools, we've taken that outside of our school-based health center locations and doing that as safely as possible external to the space. We found that districts has found this to be really critical, that we can offer the testing to both their faculty as well as students to help with that early identification of positive cases. We're also serving as trusted messengers to support individuals and families in making their decision to be vaccinated. Over the summer and really before that, many of our school-based team members were supporting our neighborhood and our mass vaccination efforts. So they were familiar faces to current students and families as well as former students. So they've been very effective in helping answer questions, meet our young people and their families where they're at in dispelling myths and concerns about the vaccine.
Yeah, you raise a lot of important points right there. I want to take a slightly different tact on this next question, and that is that those of us at the national level have been very, very concerned about childhood vaccines, flu shots, wellness checks that have not been provided over the last 18 months because many of the school-based health centers were shut down when the school facilities got shut down. Yvette, staying with you because you started it, what's happening? What are you guys seeing in Connecticut with all the delinquency in preventative care?
I think, Robert, that was one of the things that was the most concerning to us about the shutdown and schools being closed, is that those young people not being able to have that ready access to routine care. So we've been very concerned and in having a strategy to ensure that our children do not fall too far behind in their immunizations. So we approached this really proactively. When we got back in school buildings in the spring, we started scheduling those back to school physicals, and those have continued over the summer. We've tapped into our clinical dashboard through our electronic health record information. So we're able to identify children who are due, and then our team conducted outreach. We called those families, we partnered with the school nurse to get those kids in for those back to school physicals in as convenient as a manner as possible. The school nurse has really been so key for us. I had a team out all of the last 2 weeks that are doing physicals on kids that are looking to play sports in this season. And so really we've been able to catch hundreds of kids up in a really short period of time through these various mechanisms and outreach efforts.
May, what about Hawaii? What's going on there with routine?
I think similar to Yvette, we've been definitely doing outreach. We have been going through the rosters in our EMR to call back all the adolescents for their physicals and vaccine updates. We also take every opportunity for whatever the student comes into the clinic for. We review their immunizations at every visit, and if there is a missing vaccination, then we take that opportunity to update them. I have to say that we continue to have vaccine resistance to the COVID vaccine, and so we are also taking every opportunity to talk, every visit, to talk to students and their parents if we are on the phone with the parents, to just get their thoughts on what are you thinking about the vaccine, where are you with that, and to try to answer their questions and get them one step closer to taking the vaccine. I should say that we are seeing kids who want to receive the COVID vaccine, but their parents are not letting them, and so there's a mismatch going on. But I think we just continue to try to answer those questions. And then the last thing is, I should say we have a partnership with the University of Hawaii School of Medicine and also the College of Education at the University of Hawaii. And together we've developed a series of modules on COVID-19 that include prevention efforts, including vaccination. And we're rolling that out to the schools. And it's a curriculum that the teachers can just take and then roll out to their classrooms to try to educate the students on preventive health care. Because I think one of the core things that we have seen during this pandemic is with the lack of health literacy come the myths and all the misinformation and people glomming onto that rather than the scientific evidence.
Let's talk about money, because that's always an obstacle. And at the federal level, funds have been made available to support K-12 public schools and the delivery of healthcare in schools. That funding is coming through Title I, Title IV-A, relief funds, but generally those decisions on how those funds get used rests with the local superintendents. So first to you, Yvette, if a community health center doesn't have immediate resources or buy-in necessary to stand up a full school-based health center, what can they do to support students and schools and community health needs?
That is such a good question, and it comes up so often. And I've talked with folks all across the country who really feel that their hands are tied in their desire to implement school-based health services because of lack of funding. Our philosophy here at Community Health Center, Inc. has been that it's really important to meet school communities where they're at. And while the comprehensive school-based health center is the goal and the gold standard, not all districts or school buildings are ready for that. So we've taken this approach of offering school health services, and that could be standalone behavioral health or mobile dental, or the combination of those two services. Oftentimes we find that many districts aren't ready for a comprehensive school-based health center, but absolutely know that their young people need support around behavioral health services and that they cannot meet those needs. And so they're willing to engage with us as we offer a standalone behavioral health component. And often what we found is that we can get into a school building or a district, meeting them where they're at, delivering the level of service that they are ready for, interested in, can support. And then it ends up evolving to they get some resources, they're able to renovate a space, and they develop a health suite for us to then deliver that comprehensive school-based health center. We, as a federally qualified health center, have been able to develop a really strong business model that allows us to deliver the behavioral health or the mobile dental services without needing federal funding. And both of those services really take up a tiny footprint of space in school buildings. And so we often find that that is one of the key ways to be able to support our young people.
And May, you guys have such a unique model of delivering school-based healthcare out in Hawaii that, you know, your nursing program, your medical school are actively involved. Same question. You know, if a school wants a school-based health center but doesn't have the resources, how do you guys approach that?
I think similar to Yvette is meeting them where their services are, where their needs are. So for us, school-based health in Hawaii is really at its infancy, kind of restarting all over again. So we're one of the few school-based health centers actually in schools all year round. And I think it's offering what you can. For now, it's a lot of COVID response services. And then staying in touch and communicating as much as possible with the schools. What we've seen is schools often will say, we have no bandwidth to help you out. If you can come in and do a vaccine pod, that would be great, or testing. But we can't help you at all because we're stretched too thin. And so we've definitely had the experience where we go where their needs are, we bring everybody in, we try to show up on a regular basis, and then over time they see the schools have seen the value of the services and then have said, I just had a meeting yesterday, they've said, you know what, we can find the people to help make this service sustainable. And so then it becomes a much more collaborative model. So I think meeting them where they are in one little area and then slowly growing it with communication and coordination.
Let's stay with you and push that a little bit more, May. At the national level, we're seeing unprecedented coordination between community health centers, school-based health centers, community schools, our colleagues in delivering school-based health services, the nurses, the counselors, the social workers, et cetera, and district administrators. Have you guys seen this kind of collaboration in your community when it comes to policies and services and staffing? I know that they're, as you say, they're stretched thin as it is, but what about the attitude? Have you seen a change? Because there used to be silos between all of our organizations and between all of our functions, and we've seen, at least at the national level, those have come down. What are you seeing on the ground?
I think we're definitely seeing that come down. So before we used to have very intermittent meetings with our State Department of Health, and now we have twice monthly meetings. And that's allowed us to access antigen testing, other supports from the Department of Health. And on the Department of Education side, we've had regular meetings with those teams also to coordinate the policies that they're trying to implement, vaccine mandates, testing mandates, and trying to coordinate that all together. And so, like I mentioned before, it was like, okay, you can come in and just do your service, and if we can make the time, we'll make it. But now we're really seeing this integration of teams and much better communication, and so we're very happy with that. And we can also nudge them and let them know what we're seeing in the clinical realm and what the challenges families are facing in the clinical sense, so that we can streamline communication with them.
And Yvette, before you answer that question, Dr. May, what are you hearing from your political leaders? Particularly from my standpoint, particularly your federal. I know Senator Schatz has been a leader in this field, but just kind of curious what kind of cooperation and support are you seeing from your political leaders?
Honestly, from where I sit, I don't interact a lot with the federal, our senators. It's more on the city and county and state level. So, I mean, just yesterday we were talking about that we need to bring the voice of the community up, because right now I feel like it's the voice of just, Honolulu that they're hearing, and the voice of what's going on in the small communities where we're really challenged with small teams. And so we've had that discussion that we need to turn the volume up so that that others are hearing our challenges.
And Yvette, I'll toss that question to you, but folks ought to know that a big reason why the House appropriation passed were people like Joe Dunn to get us the $50 million in funding for school-based health centers, but also your Mark Maselli in picking up the phone and calling Chairwoman DeLauro's office. The chairwoman chairs House Appropriations, good person to have in your district. So that helped to move us forward. But let me let you answer that question.
Sure, and you really answered a portion of it. I will say, throughout the lifespan of Community Health Center Inc., we've always said we cannot do this work alone. And so it's always been driven by partnerships. What we've learned through the pandemic and as we are inching towards our next normal is that we are much better together, and there are just certain things that we cannot do without key partnerships. We are very blessed in Connecticut to have a strong legislative contingency that understands federally qualified health centers and gets school-based health. When we did this work supporting Connecticut's response to the pandemic, our little tiny federally qualified health center under the leadership of Mark Maselli stood up Connecticut's first and largest mass drive-through vaccination clinic on an abandoned airstrip. Made the New York Times, if I can toot our own horn, got CNN's attention. And it also got the contention of our legislatures. And so Senator Blumenthal visited us on a day when we had 12 buses of school-age children come through and be vaccinated. And there's so much power in the work that we do. I think the limitations are ones that we put on ourselves when we say we're just a federally qualified health center or we're just school-based health services. We are the trusted source of health services for our most vulnerable residents. And we need to realize that there is a lot of power that aligns with that and a lot of responsibility. And so very similar to May, we have been in conversations really regularly with our local health partners who I think really didn't see us in the full scope of what we do prior to the pandemic. And I think now we have the responsibility of nurturing those partnerships. We were a testing and a vaccination partner for small businesses. who didn't know anything about federally qualified health centers, who didn't know anything about school-based health services. But guess what? Their employees have children and have families and really need our services. And so we, cross-fertilized in our vaccination efforts. We were talking to people about, do you have a primary care home? Do you know about us? And I'm always disappointed when I find the number of people who don't know about us, but then also really happy to be able to introduce them to the scope of services that we offer. And so therein lies that silver lining, right, of this catastrophe that we're all living through, in that we have this opportunity to represent ourselves to key players and partners. I hope that, we're really trying not to lose traction with our local health leaders and districts in just the value that health centers offer in improving health outcomes, and why school-based health is so absolutely critical. Because if we can reach our young people at the youngest age, and number one, embed in them that healthcare is a right and not a privilege. If I know that I got comprehensive healthcare when I was 5 years old in kindergarten, you're not going to take that away from me when I'm 55 years old and a working, functioning adult. And also just the preventative resource that school health is just so critical.
For those of you who are on the call, you might want to be aware that on both the NAC and the SBHA website is a guidebook that I think Gina mentioned earlier that we put together to help you navigate how to work with schools. It's really worth taking time to look at that. On our website, there's another playbook, we call it, on how to do telehealth in schools. So I want to pivot for a second. We've got a few extra minutes. I want to pivot to you, May. Telehealth. Everybody used to say no telehealth. We have a board member who's a pediatrician in Dallas, and she was doing telehealth, and nobody wanted to talk to her. She was almost like a pariah, and now everybody calls her for advice. How do you like me now? How have you guys utilized telehealth? We talk about it as it's just another tool in the doctor's black bag. It's not the end all be all. How are you guys utilizing telehealth? What's your view on the use of telehealth in schools?
We've definitely embraced telehealth and really delved into the use of these new devices that enable a medical assistant to see a patient without the provider being there, but we can still do a pretty thorough examination. I won't give out any brand names, but it's allowed us, when we're short-staffed, to put a provider in a central location for 3 clinics and service them all. It has enabled us to be very consistent and provide really good care. And the kids love that kind of new gadgets where they can try things out on their own, and they're actually in command of what they want to do because they're using this device rather than someone just approaching them. So we've really been pleased with the new technology and really think that the telehealth model is here to stay.
Yvette, what about you guys?
So I love the work that May and the Waianae group is doing, and very similarly, we've it's been a long time coming for telehealth in the FQHC and the school-based health world, and another tool and another resource for more equitable access to health services. Such a tremendous resource for, obviously in the pandemic, we pivoted completely to telehealth. And the beauty of that was it allowed us to continue to take care of our kids in the most stressful and trying times in their lives. Many of our families were impacted with significant loss due to the pandemic on multiple levels, from health issues to grief and loss to just loss of everyday life opportunities. And so for our behavioral health clinicians to still be a resource, to still be able to offer individual and group. And we also found our families were much more engaged because everyone was home. And, you know, we found a lot of times the adult was hovering somewhere nearby and our clinician was able to pull them in. And so we won't lose the traction on engaging families in their child's health services that they've received from us in this capacity. And also it's done a lot of things that it's alleviated some challenges that we had around recruiting and being able to, you know, May talked about being short of provider resources. So removing the geography of needing to find someone in Connecticut that was in either our rural or urban area that represented the diversity of our patients in Connecticut was challenging. And now with telehealth and with one of the affiliates that Community Health Center Inc. sponsors, Confirm Med, we're able to remove that barrier of geography and regionalization and really be able to tap into clinical resources that cross state lines. And I know we don't have time to talk about that here today, but I'm going to do a shameless plug and say, check out our website for Confirm Med as an infrastructure and a support to anyone who is finding themselves challenged with recruiting and is looking to tap into telehealth as a mechanism for that. In Connecticut, we don't necessarily have year-round school health services. So this gives us that opportunity to do it. When we can't be in a school building because it's closed for maintenance or the school staff is on much needed time off, we can still engage with our children and families through telehealth.
Awesome. And that plug is welcome. It's going to be a great program. Let's wrap up. May, what do you see as the future of school-based health centers and how do you see them as supporting communities in ways they haven't supported communities before?
I think moving forward, people are policymakers and partnerships within the community are definitely seeing the essential nature of school-based health centers, both in the child's health and well-being, and also in their education. I think this issue about health literacy is huge and hasn't been, I don't think there's been enough of a focus on health literacy and inquiry. I also see the school-based health centers, as we've described, are an essential part of our public health infrastructure. And we haven't put enough emphasis on that. But I think moving forward, I hope that school-based health centers will always be part of that conversation.
Amen. Yvette, what about you?
Really, I echo all of that. And I would say, you know, a big piece of this is really looking at school-based health as community health and partnering with districts to align ourselves that our school-based health centers can be neighborhood health centers and really be able to extend that care to the families of our young people and to their siblings and to the neighborhood as we really look to improve the health outcomes. So again, you know, taking the limits off and realizing that we're in partnership with schools, but with neighborhoods and communities. And just the value, I hope that as education leaders and leaders of boards of education do their planning around what's offered to young people in schools and how space is utilized, keeping health in the top, you know, tier of how we're meeting the needs of our young people is so critical. Not doing this as an afterthought or as an add-on, but really having it be core to what schools are offering to their young people.
That's right. Healthy kids learn better, and the health has to come first. Thank you to my two colleagues. I just want to close with a thought, and that's that this year, for the first time, Congress has dedicated resources to opening new and expanding existing school-based health centers. As Joe Dunn was pointing out earlier, we are on Congress's radar, maybe for the first time. We've got to continue to work together to encourage legislators to fund and make policies that enable us to serve more families and students. People used to say there was a split between NAC and SBHA. I hope today's session puts that foolishness to rest. We are united in our quest to serve more families and students in need. Thank you, my colleagues. Be safe out there. Gina, I'll toss it back to you.
Okay, what a great presentation today. Thank you, Robert, Yvette, and May, for such a timely and thoughtful discussion and for your dedicated service to communities, patients, and staff. The topic of school-based health and how to advance these efforts is front and center. I'm so encouraged by recent conversations with federal officials, especially at HRSA, who are open to exploring ways in which school health partnerships can be incentivized and ways in which the critical role of convening, facilitating, and coordinating locally can be adequately recognized and sustained. Our faculty today illustrate what's possible, and so many of you around the country are doing the same. Keep up your great work with your school partners. Together, we are building a country where our school-age children and their families thrive each and every day, and most importantly, know they are cared for and valued. As you know, NAC is celebrating its 50th anniversary this year, and these monthly fireside chats offer an opportunity to highlight the impact community health centers are making every day across America, especially in this time when we're still fighting the COVID-19 pandemic. NAC is honored to represent you, the voices of 30 million patients, 1,400 community health centers, including FQHC lookalikes, 253,000 staff, and over 12,000 community board members. You can visit our website and click on the 50th anniversary screen to access all of our past webinars. Thanks for attending today, and please join us next month. Mark down this date, Tuesday, September 28th at 2 p.m. Eastern Time. We will be discussing the importance of social determinants of health and their impact on communities' well-being. We hope you've enjoyed today. Have a great rest of your day. Take care.